Good afternoon. Good afternoon, White Plains. Wow. The day before the holiday recess kicks off. Thank you, everybody. Thanks very much for jumping in today and listening to this live update. Thanks to those folks who sent questions in ahead of time. And if you're watching this later on, great. Hope to be able to answer some questions that are lingering out there. Of course, a lot of questions related to COVID-19, the latest variant, the Omicron variant, schooling, the school schedule, all of these things. I'll cover all of this today during our Q&A. I'm sure I have a ton of questions, a pretty big stack of questions to work through together today. Before we jump into that, 4 o'clock tomorrow, back by popular demand, I'm going to be doing a live holiday read aloud. Pardon me. And we'll have a number of books. I think I'm going to do like 5 books and maybe some trivia with our kiddos. And if you want to join too, that's great. Or if you want to let them jump into the live and catch a breath for maybe 30 or 45 minutes, you're welcome to do that too. But that'll be 4 o'clock tomorrow, Facebook Live. It'll be a live holiday read aloud. Look forward to doing that. And look forward to connecting with the kiddos too. So happy holidays to everybody. Hopefully you're having a good day so far today. Sun is shining. Lots happening that we'll talk about. But the first thing I sort of want to say is if you are glued to the 24 hours news cycle, try to peel yourself away from that a little bit. There is a lot of news going on right now about COVID-19, about long lines for testing. Indeed, some of you already got probably stuck in long lines for testing. A lot of negative news, That's hard. You don't realize it's having an impact or an effect on you, but it does. It's just like social media. The longer you expose yourself to it with no rest, no breaks, the more it can wear on you. So if you are watching the news, you're watching the ticker, you're watching the counts for COVID-19, try if you can to step away from that a little bit to try to relieve some of the stress that might be naturally bubbling up. It's already a stressful time of year. The holidays are always a stressful time of year. The COVID-19 spread right now in New York, yes, the Omicron variant is spreading very, very quickly. As from what I've learned from healthcare professionals, real doctors, the more time or the more variants that occur with a particular virus, typically they spread pretty quick, but they also, in some cases, lose the devastating effects that maybe they had at the beginning. And I think to a great extent, thankfully, fortunately, we're seeing that now, where folks who are testing positive for COVID-19, the Omicron variant, who have been vaccinated and boosted in many cases, are not experiencing very, very difficult symptoms. They're not very, very sick, and thank goodness for that. That's good news. That's something that it's likely that many of us, if we haven't already been exposed to COVID at some point in time over the last 20 months or so, we may be exposed to it now. That may happen. And, again, fear is a funny thing. Stress is a funny thing. If we can manage that to an extent, if we can try to manage that, you will feel better. And that's an important thing to try to remember. I know I'm not wagging my finger here, but just as somebody who was just like you going through these situations every day, just want to put that out there into the universe for you to consider. In our school district, yes, we are seeing cases of COVID-19, as you know, because you're getting the communications. Fortunately, we are not seeing an explosion of COVID-19 in our buildings at all. We are seeing it come to us. There have been occasions where we have students who are in quarantine, as many of you know. Those types of quarantine, the length and duration of quarantine, vary depending upon whether or not the child is vaccinated, and also the type of situation where the contact was posed, as well as whether or not the child is exhibiting symptoms. Same goes for adults. As always, we're working in concert with the Westchester County Department of Health to move through contact tracing and potential quarantine and isolation. It's a hassle. I know it's a hassle. And it's been going on now, right? We're doing it again. But I do think that we're going to be coming to a period of time, hopefully, as we move through the winter months, where this might change or the requirements may change. This is at least what we're hearing, as folks are trying to consider how to approach the remaining days, school days, in the winter, and then as we move into the nicer weather in the spring. So there'll be more to come on that. But again, just sharing with you, just to try to reduce some of that stress that's out there. For those of you who have been caught up in a contact trace and you're in quarantine or you're isolated right now, I am so sorry about that. I know many of us have holiday plans, and this is something that impacts us negatively, and we do apologize for that. And we do appreciate the fact that you're doing the right thing. You're trying to keep from spreading illness to other people. So, again, difficult times, a lot of challenges. We've been through this before. We were through this last year, but not the same way, because now we have a lot of different tools in our toolbox that we didn't necessarily have this time last year. So that's good news. I will talk about Test to Stay. I'm sure there are going to be questions about Test to Stay as we go through questions this morning. But probably the most important thing I'll say this morning, or this afternoon rather, is I truly hope that every one of you has an enjoyable holiday. Try to take some time to rest. Try to take some time to enjoy yourself. It has been a long haul. There's a lot going on. Every one of us has been negatively impacted by this pandemic in some form or fashion. Whether it's the loss of a loved one, loss of a job, loss of housing, whether it's a fracturing in a relationship, whether it's illness itself. There are a lot of negative consequences associated with this time period. There are also positives. We're here right now. We're here right now. That's a blessing. The ability to move forward, to the ability to continue to try to do better and to serve our kids better and to serve our community better. These are all blessings, and these are all positive outcomes, resilience, the understanding that there are going to be challenges along the way, but the ability then to overcome them. These are all positive outcomes. I wish only positive outcomes for you, but I also know that we've all experienced the negative as well. Have a happy holiday and enjoy yourself. So we're going to jump right into the questions right now. 143 of us. Thank you so much, everybody, for jumping in. And the questions, I don't know that they're in any particular order. What I will try to do, as always, is answer every question to the best of my ability. If I don't have an answer, I will say that. I will try to get back to the question of the person and get you that answer. If I don't answer your question to your satisfaction, you can always feel free to give me a ring, and happy to talk through any questions you might have. If you're going to be putting questions in the comment section here, I will try, after I get through with the stack, to answer those questions as well, but I may not see them, or I might not be able to get to them. So if you're out there and you've watched this and you still have lingering questions, feel free to reach out to me, your child's principal, any of us here in the school district, and we'll help in any way that we can. So let's jump right in. Will the school district require students and staff to get tested before returning to school after the holiday break? Thanks for your question. So we are right now planning for gateway testing. It's not going to be a requirement. Testing's never required. It is an opt-in program. So what's gateway testing mean, Joe? It means that everybody in the school district, all of the children, faculty, and staff members have the ability to get tested upon return from the holiday recess. Information will be coming out about that. That'll be taking place during the week of January 3rd and the week of January 10th. But Joe, that means they're already going to be in the building. It's true. There really is no perfect way to offer this program, to people. And again, it's a voluntary program, so not everybody will participate, but we do hope that most people do. So that'll be taking place when we come back when the children come back from the holiday recess, and you'll have information about that as well. Questioner goes on to ask, if so, what type of test should be taken within how many hours? We'll provide the tests. There's no need for anyone to do it at home, and it will be that same saliva-based rapid PCR test that we're currently administering here in the district, again, on a voluntary basis. If you haven't signed up for testing and you're interested in doing so, you can still sign up and be part of the random testing that takes place regularly here in the school district. For students who are participating in the COVID test program, how do parents receive the results? Do they get notified if the child tests positive? And will the district be distributing test kits over the holiday break? I'll take them from the reverse up. The district will not be sending out test kits during the holiday break. Parents do receive notification of positivity directly from the lab and follow up with us. Generally through email is the mode that information is shared. Thank you very much for your questions. When will the district make a decision as to whether or not they will switch to a full remote after the holiday break? Thanks for that question. I know it's out there in a lot of people's minds. The decision is this. It's already been made. We are going to be open for in-person instruction. You have heard me talk about this and you've heard everybody in the school district talk about how important it is for us to be available, for us to be open, for in-person instruction for our children every day, how important it is for our families. There are two things that could change that structure and that plan. One is if the government forces schools to close, which we do not think that will be happening. And number two is if we don't have the ability to operate, to function safely. So if we had a number of faculty and staff members who were out and it impeded our ability to function safely. Those are the two reasons. We do not intend to close the school district, and that's not being cavalier. That's because what we know and what we've learned now over this period of time is the negative repercussions of children who are either on remote or in hybrid, and that discontinuity of instruction is a real problem, and we don't want to go backwards that way. So I know that's not welcome news to some folks. I know some folks want to close, proactively close, go into remote for a period of time in the hopes that it could slow or stop the spread of the Omicron variant or COVID-19 in general. That is not something we are in a position to do, and we do not believe that would be in the best interest of our children or our community. But again, we will continue to keep you posted on any changes as they arise, and we'll make sure that nobody's caught by surprise from anything. So we'll keep communicating clearly. Thank you for your question. Next question on remote learning. As we prepare sorry, for the December holiday recess, I was wondering what criteria the school district will use to determine if students will return to in-person learning. And third, if the district decides to pivot to remote learning, when will parents be notified? Thank you for your questions. I think probably we'll get a number of similarly composed or pointed questions about this. Again, we intend to be open. While we did and are planning to be prepared for an unanticipated shift to remote. So what does that mean? It means taking home your iPads, getting lessons ready, making sure that the technology is in place if we had to. We are not planning for that to happen. So we're preparing, but we're not planning for it. If we had to, parents would be notified as soon as possible. So as soon as we know, we would notify parents and guardians. Please keep in mind that families need sufficient notice to make childcare arrangements. Absolutely, and believe me, you don't need to remind me about that. We are very, very sensitive to how difficult a shift to remote or hybrid instruction is on our parents and guardians and the households in our community. And that's why we're trying to avoid that with everything that we can. Thank you for your questions. Next questions. I understand some high school teachers are getting together packets and Zoom links ready to go remote. Yes, so these questions are all the same, and I think I've just answered those. Is it possible for one or two schools to have to go remote and the others to stay open? Oh, absolutely. I don't ever foresee the district fully going full remote. Again, absent some major situation that is absolutely unanticipated at this time. If we had to go remote, we would start at the smallest level of impact possible. That might be one class. It might be a grade level, or it might be a building, but we certainly would do it as small as we possibly could to have the least amount of disruption to our families and to our children. With the latest news about the January regents being canceled, what do you think the chances are that the spring regents would also be canceled, and what about state testing? Thank you so much for your questions. Yes, we advocated for the January regents to be held this year, not to be administered. We're continuing to advocate also because we are still in a pandemic, that our children not be forced to take the regents in the spring, and again with high stakes standardized assessments to hold them in abeyance as well until we're fully out of this COVID-19 pandemic. So we'll keep you posted on that, but we do continue to advocate, and I must say and must thank our elected officials, our Senate leader, our Senate Education Chair, Senator Mayer, all of our local officials who have helped us to advocate and continue to advocate to the federal government to try to make changes that are going to benefit our kids. Good morning, happy holidays. With the rise of COVID cases, what is the determining factor that will be used whether to switch to remote? I think we covered that. Since the number of vaccinated students and staff is higher at the high school, will the decision be made based on buildings or will it be needed? Yep, so I think we covered that. Thank you very much for your questions. It would be, we would only be deciding based on what the particular needs were in a given building. Okay, next question. As As a district, have you considered taking the remote possibility on a school-by-school basis? Yep, so I think similar questions. We just answered that. This isn't a question, but it's a plea to please keep schools open. Our children need to be in school. So we agree, and we know how hard this has been, and we also know for folks watching that parents are they're on different sides of this conversation. Some parents very, very strongly, parents and guardians very, very strongly would want a remote option. Other parents very, very strongly, equally, think that no, absolutely, kids need to be in school. We believe that children need to be in school, and we would like to avoid at all costs moving backwards into a situation that again disrupts their instructional continuity. Great question. Thank you. While none of us loves remote learning, is the district considering a 2-week post-holiday remote period, considering the increase in cases locally? No. If so, would recommendations also be given to family and staff to self-isolate as much as possible? So I think the recommendation for families, for staff, for everybody in our community is to be as safe as you can. Many people in our community are vaccinated, and many people in our community are boosted. So you're doing things that you can do to try and minimize the chances of you contracting this particular illness. But there are other illnesses that you don't want to contract either for the holidays. So do your best to keep yourself safe and healthy, right? And it's not just vaccines and medicine. It's also listening to your body, making sure you're getting exercise, drinking water, getting sleep, all those things, reducing stress, right? All the things that are really hard to do. But these things go a long way also to making sure that you as a total human are in a good position to be able to fight off any illnesses. Okay, thank you for your question. Next question. Teachers at Ridgeway have sent a notice that our children will be coming home with iPads for the break. In case of school, do you have intentions of going remote? And if so, for how long? No, we just want to be prepared. Right? We just want to be prepared. So that's really important. It's a great question. I've been hearing it a lot lately. Why are we preparing? We're preparing so that we don't get caught flat-footed. We're preparing so that we don't look like some of the testing places look like in and around our area and around the country with lines outside. Why would there be lines outside of tests? So we're trying to think ahead. We're trying to learn from what we experienced in the past so that if and when something does happen, we are ready for it. Thank you for your question. Oh, the next question is who makes the decision? You or the Department of Health? What's the criteria for going remote? Ultimately, the decision for our local school district is made with recommendations from me to the Board of Education. The Department of Health has the ability to close schools, though they don't, because they work alongside us. And the criteria is whether or not we can operate safely. Thank you. Next question. Are there any plans to... No. Same question. Thank you for your question. Next question. I see daily emails regarding COVID cases. How many cases? Is it determined if there's an outbreak, and will the school go remote? So we're not having outbreaks at school. We're identifying kids who are coming to us or adults who are coming to us who have contracted the virus, and through our testing, we're identifying it, or through testing that's being taken place at home, and then parents are notifying us, and that's good news. Are all students and staff required to get a COVID test if sick before returning to school? There are a couple of different ways that you can return. One of them is getting a test. Other is just to wait the period out and then the quarantine period out and then coming back. Is there a possibility of remote option if positivity rates continue to increase in Westchester? There's always a possibility of anything, but what we don't want to do is get to that position. So we are, again, doing everything we can to avoid going in a remote direction, but we will certainly keep you posted and certainly keep in contact with our team members here in the county to continue to watch the case numbers as well as the case numbers in our own town. Okay, next question. There seems to be an uptick in positive cases according to the alerts I see, which I'm guessing is happening across all schools. Approximately how many people are participating in the district's COVID testing program? Is there any correlation between the results and positive cases, or is the district alerted through positive cases in other channels too, or both? I'm curious to hear about the findings of saliva testing. Thanks for your question. So we're notified through various channels as to when folks are identified as COVID positive. Could be from them at home, from doctors, could be from the health department, could be from our testing program. Right now we've tested about 1,000 people. Remember, it's a voluntary program. So we've administered about 1,000 tests over the last few weeks when we've had the testing program going. And we've identified about 10 as positive. So again, you're looking at it. You're looking at it as a percentage. There, it's not a huge percentage, but every little bit helps, and every little bit counts. So we're going to continue to run those testing opportunities. Thanks very much for your question. Next question. The New York State COVID dashboard indicates that Westchester is around 9%. It is, depending upon which day, the 7-day rolling average you're looking at. At present, there is a control group being tested at the high school, but no random testing at all. How can we know if the data, how can we know the data if we do not have the data? Will White Plains consider implementing random testing of 10% of its student body so as to provide accurate information to families? Thanks for your question. So we're randomly testing 20%. It's already happening, but again, it's voluntary. We cannot force people to participate in the testing program. So if you're interested, if you're not already participating and you're interested in participating, please feel free to do so. And that's going to be available for as long as we can keep it available. We heard from the Biden administration that they're going to be making something like 500 million tests available to all throughout the country. We also heard the other day from Governor Hochul that she is putting additional funds and resources into testing here in the state, and we're talking about the Test to Stay program, which if it's not in the questions here, I will address as well before we wrap up today. And it's right in this next question. Okay, I am interested in the January quarantine protocols for students fully vaccinated. Do we have, excuse me, do we share a copy of the vaccination card with the district nurse and the school nurse? And then students will no longer be quarantined if they're asymptomatic. Thank you for your question. If you are interested in sharing your vaccination, your COVID-19 vaccination status with your school nurse, that would be great to do. You don't have to, but that would certainly be helpful and go a long way. As you make mention, if your child is caught up as a potential contact in a contact trace, that vaccination status can help to reduce or even avoid altogether potential quarantine or isolation. The next question is about Test to Stay. Will there be a Test to Stay program, and if so, who is eligible? How will it work in White Plains? So for those folks who don't know what Test to Stay is, the Test to Stay program is a program that's being implemented around the country. It just got approval, or rather support, from CDC last Friday, where if somebody is potentially exposed to COVID-19, they can continue to go to school or work or whatever the case may be, if they pass or if they take and pass a test every day that they are not COVID positive for 7 days. So it's as you can imagine, in a larger organization, that's a pretty big undertaking, depending upon the number of folks who may need to be tested. There are also some considerations that the district has to look at, and we're working right now with the State Department of Health to clarify, like, for instance, if a child is participating in Test to Stay, right now the requirements don't allow that child to use district transportation to come to school to test. The guidelines also don't allow at-home testing. So we need to work through some of those areas to make sure that if we're able to implement a Test to Stay program here in White Plains, that we can do so effectively, and that all of our families will have equal access to the program. If you don't have a car and you can't drive the child to the testing spot, that really puts you at a disadvantage of being able to participate if they can't get on a bus. Similarly, if the district doesn't have the number of tests needed to be able to successfully put the program in motion, that's problematic as well. So I do know, and folks have shared with me, believe me, I know, because we're in close contact with all of our colleagues in school districts around the county, that some districts are right now implementing Test to Stay. Smaller school districts, definitely a different look than if you're a larger city school district or the like. But our reopening committee is going to explore Test to Stay and whether or not something we can employ here in the White Plains City School District at our next reopening committee meeting, which is scheduled for January 8th, 2022. So following the holiday recess, we will be discussing that. I do think there will be more information coming out from both the federal government and the state government in the days between now and our next reopening committee meeting, and hopefully that information will help us to be able to pin down whether or not this is something we can accomplish here in the White Plains City School District. We certainly want to avoid quarantine and isolation anytime we can. So this is something we're going to give a really hard look to, and more information will be coming out to you following the holiday recess. Thank you very much for your question. The other question is there any other space that can be used for lunchtime eating so fewer students are exposed and potentially quarantined? For example, some districts use other school space such as cafeteria, gym, classrooms to increase distance. We are using every space that we have available. Thank you for your question, for kids to be able to eat and space out while they're eating. So yeah, you're absolutely right. And happy holidays to you too. Okay, next question. I think I already answered this question. This is the one about packets and Zoom links getting set up. So yes, we want to be prepared in case we had to go remote, and no, we are not planning on going remote. Will the White Plains City School District be going remote? Parents deserve to know in advance. Yes, parents absolutely deserve to know in advance. Parents and guardians would absolutely know in advance. Please send this message far and wide. Just think for anybody who's not watching, who doesn't see this, we are not planning to go remote. We're preparing in case we have to. That's really, really important. Please make sure during the recess period, we're still watching and making sure we're not exposing ourselves to situations that could potentially get us sick and then have a negative impact when we return on the 3rd. Our community's been fantastic about kind of self-monitoring and monitoring at home and not sending children to school or coming to work when we're sick, when we're not feeling well. It is always better to err on the side of safety and know that you don't have COVID-19 before you potentially expose other folks in the building. So that is something that we want to continue to drive that message home every day. Highlands is sending out emails every day about learning that there was a person tested for COVID. Yes, every day. Almost all of our buildings every day are letting their school communities know anytime we identify somebody in the school community who has tested positive for COVID. Sometimes those tests, those individuals weren't in the building, were at home, tested, and we find out. Sometimes they were in the building, but because of our mitigating strategies, have very few impacts in the school community. But other times, let's say if it's in a sporting event, you could have a much more far-reaching contact trace and potential quarantine and isolation. So it's all different depending upon the circumstances and the situation. But there is no doubt, as we know, the Omicron variant is around and it is spreading. Okay, next question. My child goes to Highlands. I was being told by a teacher that kids may not be going back to in-person live learning after a break. Please keep things the way they are so children don't regress. So yes, so no, we are not. We are coming back on January 3rd unless something happens where we're unable to. So do not plan to be remote on January 3rd. Plan to be in school in person. Thank you very much. Next questions, a bunch of questions here, so I'll do my best. At what point are we going to decide to move to remote or change the model? I think I answered this already. And the questioner goes on to talk about that case numbers are rising, that some people don't wear their masks correctly, that some people may send their children to school if they are ill, if they don't have an option, that remote should be available. They know it's more effort. But they think that if parents want to use remote, they should have a choice to use remote. Thank you very much for your question. Certainly understand it, certainly respect your position as we have throughout the entire ordeal. But at this point in time right now, we are focusing on in-person instruction and keeping continuity of instruction in person. I understand that remote didn't work for some, but it did for others. Why you're forcing families into a dangerous situation. I have a child who is 100% exposed at school, which now compromises my family. Sorry about that. We're not forcing families into dangerous situations. We wouldn't be doing something that's dangerous. The facts are that even if, and you hate to even say this, but even if somebody catches the Omicron virus, there are so many different layers and mitigating strategies that are able to be employed right now, that the chances of this being a deadly or devastating situation are far, far reduced. We would certainly never put children in a danger, or anybody in our school community in a dangerous situation. That said, completely understand, parents and guardians need to make decisions that are based in the best interest of their children. I always advocate for folks to talk to their doctors. Their pediatricians, healthcare professionals related to their concerns about in-person learning. I have found from speaking with doctors that, actually I haven't found a single doctor that I've spoken with that says in-person learning isn't the optimal. So, from the medical profession, getting into school, being in school and taking the appropriate steps, but being in school to learn seems, according to the field, to, again, be the goal for everybody. Testing is low at school, therefore numbers are inaccurate. Kids and families don't have access. Can we provide rapid tests at school as needed? So we have rapid tests available, but we also have PCR testing available. It's voluntary, so folks have to participate, sign up to participate. And as I mentioned a couple times this afternoon, you can still do that. We are not forcing people to test. That's not within our purview, but we are making these opportunities available to our community. We think that's really important to do. I agree with you. The more people who test, the better sense of what we're looking at in our total school community population we would have. But right now we're working with what we have, we're working with what we can get. And again, if somebody was in a situation where they needed access to testing, certainly reach out. Reach out to us and we'll do everything we can to help. Next question. The volume of schoolwork this year is too much for kids to handle, especially coming out of being remote. However, homework is significant. There's lots for kids to handle. I can address this for my child, but this is an overall theme that has been addressed in the past. Please ask the administration to come up with a way to review the kids' workload across all classes. Thanks for your thoughts. I would say absolutely, if you, parents or guardians, if you're experiencing difficulty in class with regard to the amount of classwork, the amount of homework, please reach out to your child's teacher. This is a conversation about your child. Homework for children is different. The same homework assignment assigned to an entire class is going to have it's going to be a different length of time to complete for every child in that class. So, blanket sort of policy related to homework or classwork doesn't typically work well because so much of education is individualized. But if you're experiencing something difficult or your child is stressed out, too much work, too much homework, please reach out to your child's teachers and or your child's principal. We would absolutely be happy to help in any way we can. Next question. As our community heads into a much needed break, it has become apparent that teachers are assigning schoolwork over Christmas, New Year, holiday recess. We're all aware of the toll the current pandemic takes on everyone. The mental health of our faculty, staff, students should be paramount. Goal should be enjoying the respite. Children often spend evenings and weekends committed to their homework. Can we offer a student a district-supported break so that our children might enjoy being with their family and loved ones, resting and relaxing, and not responsible for completing assignments? Thank you very much for your question, for your ideas. I think I sort of just touched on that with the previous questioner. There are children who love getting homework. I know. Some kids who are watching are like, no way, Joe, no way, Dr. Ricca. There are children who love, getting the work that they're getting. There are other children who this is a major, problem for. It's different in every situation. So I would never say, a blanket, we're not doing homework. What I would urge is that for any family who's experiencing difficulty with assignments, to please connect with your child's teacher. Our teachers are so willing to help and modify and adjust to help our kiddos. They just need to know. So if your child's experiencing something, let's say, you have a lot of assignments that are being given over the break, talk to them. Would I support few assignments over the holiday break? Of course I would. Absolutely, I would be supportive of that. I would also be very, very supportive of children making sure they're reading every day and making sure they're working on, a little bit of academic upkeep each day, just like you would approach any positive habit, even in the off days, right? So, as always, moms and dads, parents and guardians can make decisions at home about what's best for their child, about what's best for their home. But please make sure you're communicating with our teachers as well, because they would be very happy to help. Next question. I signed up my kids for random testing in school. They bring home a test tube on Tuesdays. It needs to be filled with saliva when they wake up in the morning. However, it's hard for them to fill it up. Is there another way to do it? Swab is okay for them. Sorry, right now the PCR, a rapid PCR test that we have available to us right now is that saliva test. Sorry about that. What is the proper protocol when someone is not feeling well or decided to get tested? Isn't it proper that they have to wait for the results of the COVID test before they go out, go to work, or go to school? It's just frustrating to receive a note that your child was exposed to the virus just because someone went to school sick or waiting for the test results, which came back positive. Yeah, understand your frustration. Certainly uh, if you feel sick, you should stay home, and that's something we've said. And by the way, that has nothing to do with that has to do with everything, not just COVID-19. If you don't feel well, stay home. If you have a cold, stay home. Don't go out and spread your cold around, or don't go out and spread your flu around or COVID-19 around. Stay home until you're better. If you have questions about that or what you should do, definitely reach out to your doctor. We have been advocating that if folks have an outstanding PCR test, an outstanding COVID-19 test, they're waiting for results, wait. Wait until you get those results before coming into school. There have been times where children have come to school. They don't feel sick, they're asymptomatic, but they come to school and we find out, halfway through the day that a test that they took over the weekend came back positive. That's not helpful. Those are few and far between, but it does happen. Thank you very much for your question, for bringing this up so that we can all remember to stay home if we're not feeling well, and if we're waiting on the outcome of a test, definitely wait for that all clear before coming into school. Next question, are the kids going back to school right after the holiday? Yes, we're coming back to school on the 3rd, in person. Next question. Where do things stand with the test to stay plans? Will the district be providing testing of, how hard is it to find a PCR test? Can the district provide any testing? Thank you very much for your question. I think I kind of went through that a little bit. Finding access to testing is a challenge. We've done, I think, credit to our team members here, done a good job of securing testing all throughout the pandemic so that we have it. Our community partner that we're working with too to administer the rapid PCR test has access to the testing. Again, saliva based, so I know for some of our kiddos that's not easy to spit into that tube. But we do have testing available right now. And test to stay, again, we'll look at more fully and make a determination at the reopening committee and Board of Education level based on what we're able to do. That'll be after the recess. And last question, and then I'll go to the comment section. Hi, how much of the COVID relief money went towards teacher and staff bonuses? I was under the impression it was to be used for air conditioning and other school improvements. How are the amounts decided? Some people perform better than others during the pandemic, and I hope that's reflected in the bonuses. Well, thank you very much for your question. I'm glad you brought this up. On Monday evening, the Board of Education approved, after approval from the federal government and approval from the New York State Education Department, a portion of the American Rescue Plan in the White Plains City School District was utilized as a wellness incentive to our faculty and staff members. Everybody who came in to work during the pandemic was offered a $500 wellness incentive. Our hope is that folks will use that money, they will invest that money into things that will make them feel good, keep them strong, keep them healthy. I don't know, maybe some people apply it to a gym membership, maybe they apply it to a yoga class, maybe they apply it to, going to get a massage. I'm not sure. But whatever the case may be, the hope here and the spirit behind this was thank you. An investment in our employees, an investment in our school community is an investment in our children. It's an investment in the greater community. So it was a fraction, pennies of what was taken as part of the American Rescue Plan to devote to, but we believe they were very, very important and a very good investment. To your question about air conditioning and the other, yes, absolutely. The American Rescue Plan is being used to do the air conditioning. None of that was changed. This wellness incentive was part of our plan really from the get-go. And we saw it as a really important way to say thank you to folks who didn't have to be here, but were every day. This is even before we came back in hybrid, right? So these are people who were around all the time. Now, what does it break out to? It breaks out to about $2.70 a day. $2.70 a day, $50 a month, $500 for 10 months. So, it's not a huge amount, but it's an important amount, and I believe it's an important investment in our folks. So I appreciate the question. I thank you for bringing it up. I think we could all agree that there were a lot of instances where people went above and beyond anything that could ever have been expected, and that's not just in education. It's all over. Folks really did show up, and for those who showed up every day for our kids, we wanted to say thank you. So thanks for that question, and that brings me to the end of that stack of questions. I will go right now in the section. Let me see. Okay, let's see. I'm gonna scroll up. Thank you, everybody. Happy holidays. And Just like that, here comes Mrs. Torres with a list of questions that I think were in there. Not many. All right, thanks, Liza. Okay, so we have a couple statements. I'm sorry at this point, this is all a bit redundant. At some point, isolation quarantine is going to have to come to an end. Also, for children who are unvaccinated, for them to be treated differently is not fair. We know that vax people can spread it and get it. Children who are not vaccinated should not have to quarantine longer. It's also a way of trying to push these kids to get a shot. Not cool, White Plains. It's not at all that. At all. In fact, White Plains doesn't make the rules for quarantine and isolation. No school district does. These rules are made by medical folks. I'm a history teacher. I'm not a epidemiologist. So I understand your frustration. I mean, we're all in the same situation, but it has nothing to do with White Plains or Somers or New Rochelle. Or these are the rules that we're all following. Families shouldn't be forced back if they don't feel safe. Westchester's at 11%, and this will be higher coming back. Other schools have already closed. My kid and others recently exposed at school. To be fair to all, can we go remote? No, that either. So it's interesting, right? Because these are two statements, but and you get a sense. Everybody is coming to this, has always been coming to this from a different place. And look, I respect everybody's position. Our goal here in the school district is to get our kids to their desks and keep instructional continuity to the extent that we can. I understand there are so many different challenges that are out there. I do think we're in a better place today than we were a year ago today. With moms and dads trying to juggle schedules, figure out a hybrid schedule, deal with the Wednesday schedule, deal with the quarantine and isolation that was still taking place then, and no vaccine. I mean, when I think back, I'm thankful, I'm grateful. I'm grateful for a lot of things that happened in the last year. I'm frustrated that we're not out of the pandemic, but also, trying to keep a sort of positive and realistic view about where we're going to go. I think that we're going to continue to go in the right direction. I absolutely understand, and I wish I could fix this for folks, but it's kind of one of those situations that we're all dealing with together. Thank you for your thoughts. Here's a question. There's a lot of bus exposure quarantines that are likely unnecessary due to the time spent on the bus being less than 15 minutes. Is there another way to better monitor bus time for our children to limit unnecessary quarantines? Thanks for the question. It's a great question. 15 minutes is a short amount of time. There's really nothing that we could do in terms of bus routes. Parents and guardians could choose to drive their children, though I wouldn't necessarily advocate for that at this point. I think we're doing okay. We transport thousands of kids every day. And yes, we've had situations where because of a potential exposure on a bus, we've had quarantines and isolations. But, again, thinking about the totality of the organization, thousands of children, right? Thousands of bus runs since the beginning of the academic year. I think we're in pretty solid shape there. Doesn't mean that it doesn't happen, but definitely, not as bad as it could be. But I do appreciate that question. Question is, was the wellness incentive just for the White Plains School District, or was this a state countywide initiative? I don't know if any other school districts, chose or were able to provide a wellness incentive to their school districts. I know that other school districts in the country did, but I'm not quite sure about Westchester County or the state of New York. Thank you for your question. Let me scroll in here real quick. Lots of statements. I appreciate it. Thanks, everybody. And happy holidays to everybody, too. Merry Christmas. Happy Kwanzaa. Happy New Year. Is there voluntary testing available now? If so, where? There is testing available. First of all, let me say this. There's testing available in the city of White Plains right now. If you follow me on Twitter, I just sent out where those sites are. You can also go to the City of White Plains website. I'm sure they have that information there. But there is testing available in the City of White Plains. In the school district, yes, you can sign up to be part of the voluntary testing, random testing. That's something you can do. Please feel free to email Nurse Maggie at your convenience, and we can get you signed up for that too. Feliz Navidad. Thanks, everybody. Lots of. Listen, I just have to say thank you so much. I cannot believe that we're still talking about this, right? It's crazy. But I just want to thank all of you for so much positivity and support. I am personally really, really grateful for that. It's a long road. It's been a long road. But thank you for being there. We've really kind of worked together in so many different ways, not always agreeing. Certainly I made a lot of mistakes along the way, but trying to be transparent, trying to be communicative, and trying to fix as much as we can and do as much as we can for our kids. That's been the goal. So I really appreciate all of this. Thank you. Right, happy holidays. A lot of happy holidays. Okay, so I think I wrapped it up for now. Remember, tomorrow at 4 o'clock, going to do a little special holiday read aloud, some trivia with the kiddos. So if you have time tomorrow, I wanted to do it at 4. I don't want to do it at like dinner time or anything like that. But hopefully that's a good time for you, and you could bank on probably about a good 30 minutes, maybe even 45 minutes. 5 books, some trivia, and look forward to that. I also again thank on behalf of the Board of Education, on behalf of everybody in the White Plains City School District. Have a wonderful holiday. Try to get some rest. Try to unplug a little bit if you can. And once again, from me, from my family, thank you for everything. Grateful to be part of this amazing community. Have a great holiday. Stay safe, stay strong, and stay WP proud, everyone. Take care, and I'll see you tomorrow for the Read Aloud.